Good morning, everyone. So I was reading the paper, and I saw that there was going to be an announcement on FASD by a senior bureaucrat from the Ministry of Children and Youth Services. So I perked up, and I thought for a minute, and I was getting over the flu, and I realized, oh my God, it's me. I'm giving that announcement, but nobody told me that. And so I just want to get rid of the elephant in the room. If you're expecting an announcement today, there isn't one. But that doesn't mean we're not very, very engaged and very, very committed to this. I mean, you heard Mr. Grenville Anderson talking this morning, and we have a momentum going that isn't going away, but there is no announcement today. So if you're going to be listening to my words and waiting for that, I just wanted to put that to bed. Fair enough? What I do want to do today is to provide you with an update on the development of the FASD strategy. So there was a lot of rationale for why government paid attention. We know for sure all of the reasons, and I'm certainly not going to in any way assume that I need to tell you about the reasons why we need to pay attention to FASD. I'm not going to do that, even though the slides talk to that. But in the Ministry of Children and Youth Services, we've been a ministry for about 10 years now, and we have undertaken a number of transformations. It's very important to us, and the reason why we put together this ministry was because we wanted to understand the whole child and the developmental stages of the whole child. And we understand that children come with many needs that include mental health, complex special needs, autism. They get involved in youth justice, child welfare, the early years. They may have FASD. There's a lot going on with them, and they're the same kids often and the same families. And they connect with education and health and social services and in communities. And hopefully, God willing, they grow up and they become adults who are contributing members to society. So the reason our ministry was created was to understand those things together. And we've been very proud of the transformations that we've been doing, kind of one at a time, and we cascade over them. And so when this government, this particular mandate came in, the question of FASD was a glaring one. We haven't paid attention to this in the way that we need to. We haven't understood it. And not that it's a separate thing. It's not. It's got to be nestled in communities and nestled in sectors across. And so it was for that reason, I believe, that the Premier put into our ministers, Tracy McCharles' mandate letter, a requirement for her to go and explore this and really understand FASD and come up with a strategy. And that is why she directed our parliamentary assistant in his mandate letter that this became his signature piece. So that was very exciting to us. I hear it was exciting to you too. We're all in this together. And so that's what we've been doing. We've been undertaking a way to learn about this, to understand it, and behind the scenes within government, I'll talk about that in a minute, to make sure that we're connecting it in the right way. So it's not its own story, it's a story that connects and fits with other things. Sorry, I never stick to my notes, that's my problem. So you do know that in 2015, we went out and did the public-facing stuff, and it was a bunch of it that we did. We had 25 roundtables, and a number of them were bilateral and were focused on Aboriginal, so First Nations, Métis, Inuit, and Urban Aboriginal groups that came together. And we were delighted that people with lived experience, parents, families, children, and many practitioners, and many folks who have worked on this for years came and talked to us. I would have to echo what Mr. Anderson said, that despite the heavy topic, and despite the fact that we asked people to stay all day, I sort of wondered in my mind whether that was going to be too much. The day was full, and people talked till the end, and there was this light feeling. Although the topic is a serious and heavy one, there was a feeling of hope and a sense of really wanting to be together that was really, really encouraging. So we know about the roundtable report. And there were other inputs that we had as well. So in addition to that, and this is important behind the scenes work, I began to chair an interministerial directors group. And that includes many ministries: Aboriginal Affairs, Attorney General, Community and Social Services, Community Safety and Correctional Services, Education, Health and Long-Term Care, Training Colleges and University, and Citizen Immigration and International Trade. And that was important to us because we each have things in our portfolios, in our ministries, as you look along the whole lifespan of people with FASD and families affected by this, that we're already doing. I'll give you examples. We train professionals. We train doctors, we train nurses, we train teachers, we train workers in communities. We provide funding all over the place for this. Have we paid attention to, for example, of what kind of training folks get on FASD? What it is, what it looks like, what they should do when they see it, what it might look like, and sort of what the things might be that are problematic if they don't understand that a young person or a person who's in an institution incarcerated have FASD and they believe that these things are behavioral and intentional. We have lots of training we already do. So what would it look like if we thought about it across systems to say, if we focused on FASD, what kind of progress could we make in building awareness and training and understanding? So that's the kind of thing we've been talking about in our directors group. We implemented a web-based survey, and that was a way to get people to talk to us and give us information or to give us their views. And if any of you provided views, thank you. We read everything that we saw, and we really thought about what advice you gave and what things resonated and were common and what things weren't common, and we really appreciated all of that. We established an expert group of FASD researchers and clinicians to ensure the strategy was guided by the right input and subject matter expertise. We're not pretending we're subject matter expertise, but these folks have been absolutely wonderful. Many of them are in the room. I want to thank them because they've taken a lot of time. We've been so candid with them. They've been so generous with us in their time and providing their advice and expertise, and they've been really, really good places to go for us to talk, both informally and in committee. And we then conducted interviews with key informants across Canada to seek input and advice. And there's many provinces that have done really good work, and we don't want to pretend that we need to start from scratch. And there's a good federal momentum, and we've got a good partnership with the federal government, and we really wanted to understand those things. So if we heard of a good name and an interesting person, we did a nose dive into a conversation with them over the telephone and had really rich conversations about this. And we hired a researcher to conduct some research to inform awareness, prevention, and targeted intervention strategies to support women and their partners on alcohol-free pregnancy. That report is just coming to us. So the inputs aren't over, and it's certainly not like we can tick to say we're finished this period of absorbing information. We're not. We're never going to finish. This is the slide I'm not really going to talk to you about because you know what we know. But I just wanted to put it up there to show that we know it too. We've heard it from you. There's a lot of compelling reason why we need to be able to articulate well the business case for why government has to pay attention to this issue. And this is kind of the storyline of what we use. So I put that up there for you. And I'm sure you're looking at it and thinking, oh, I've got 5 other bullets that are up there that should be up there. And you're absolutely right. And building that case and really, really describing why we passionately and firmly believe that we have to pay attention to this topic is an important part of all of this. So what we learned, so trying to put that into a few bullets isn't always so easy, but families have told government that they don't know where to go for programs, services, and supports, and what to do when they have a concern. So when you strip away everything, people just want to know where to go for help. It's that simple, right? They don't know. It's confusing. And often, it's not there when they find it, which is a bit of a contradictory. They want clear access points to facilitate earlier diagnosis and to receive appropriate and timely services. So that was a big piece, and access is a key theme in our ministry. People need to know in their communities where to go for service, how to get there, and what they're going to get when they go. And diagnostic services are limited and hard to access, right? And it doesn't mean that there's a magic key that comes because there's a diagnosis. It's not like we're not going to serve you if you don't have a diagnosis, and we will serve you if you do. But diagnosis, in terms of providing information, is very important. So in many parts of the province, families report long waiting lists to get a diagnosis. Diagnosis for FASD is the process is complex, as you know, right? It's not simple for them to get access. And they report having to pay out of pocket for travel, clinical diagnostic services, all the pieces they have to go to get the diagnosis, and that's a hardship. So we heard that a lot. Finding services to meet the needs of individuals living with FASD is difficult, and services themselves are limited. So you know that they often require folks with FASD and their families to support and a range of professionals and programs delivered by a variety of service providers. And so sometimes it's not there. And they've expressed frustration in having to tell their stories multiple times. And telling it to people sometimes who have limited understanding about what that means and what they're talking about. And again, not a specific FASD issue. We hear that on other files, but an important thing to listen to. So we have two things we have to do. Look at the access, and when they get there, look at what we're giving them. Not giving them, offering, providing. So those are systemic things. They're difficult and complex things. It's not something you can throw some money at and claim victory. This has got to be embedded in everything that we do across the sectors. They need lifelong support, family and folks with FASD and caregivers. It's not something that's cured or goes away. We know that. So they struggle, families, often with their loved ones, and they frequently express a sense of failure and isolation and helplessness and anger, and they need support. They need support to be in an environment where they can be optimistic and hopeful, and that speaks to respite and support services for families and caregivers. We hear they're often difficult to access and the wait times are long. And when you need respite support, you need it now, right? Not in 5 months. We heard a lot from our Indigenous partners and around the need for culturally based and culturally specific programs and services and supports that are preventative, family-centered, holistic, strength-based, and needed to support those with FASD in Indigenous communities, right? And talking about it in a way that is empowering and positive and culturally specific. And it's not just one culture within Indigenous. There are many cultures within First Nations, Métis, Inuit, and urban Aboriginal communities. And even within those communities, there are different approaches that work and that make sense. So we heard those things, and we are reflecting on them. The focus areas have kind of emerged out of these things. And, you know, as I listen to the federal key focus areas, they're not dissimilar to ours. And they kind of, you know, we put them out there when we were in the roundtables, and they still continue to make sense to us as organizers. So awareness and prevention. This is about greater awareness of FASD and the risks associated with maternal drinking, contributing to a reduction in prevalence. Nobody, I hope, would disagree with that. Screening, assessment, and diagnosis. So individuals affected by FASD need to be identified earlier, know where to go for diagnosis and service. Programs and services. So this is about effective and client-centered programs, services, and supports that respond to the needs of individuals across their lifespan. So I come from the Ministry of Children and Youth Services, but this strategy is intended to be across the lifespan. That's why we have an all-in ministry approach, right? And it needs to, you know, for example, deal with seniors. It does. That one's a bit harder to probe. Actually, that would be an interesting piece of conversation. What does it look like for a senior with FASD? What kind of supports do they need? Those kinds of pieces. Supports for families and caregivers, another one that would make sense to you. So this is about access to supports for families and caregivers to strengthen their capacity to care for the members of their families living with FASD, and I might add to care for themselves, to care for themselves. And we find as we think about that these categories are not mutually exclusive. The programs and services and supports for families and caregivers really do dovetail, and they should dovetail together. They're important enough that we put them in two, but they do really work together. They should work together. And the last one is an important piece around surveillance. So this is about data collection and performance measurement. Because if you measure it and if you report on it, people pay attention. And government gets called to account. And we want to be called to account on this one. So when you're doing a setup of a strategy, paying attention to this piece is an important one. So this is about monitoring and surveillance systems to achieve better results, about being able to evaluate the impacts and to plan based on evidence of need and system priorities subject to requirements of performance measurement. So if you distill all of that down, what it means is that we want to be able to measure and track and report and make that transparent and public. So we're holding ourselves and you and the province accountable for the progress we're making. A bit of a report card. So you can imagine how to do that in a way that is honest and fair is not an easy piece. And we're borrowing from other strategies that we've done, like the poverty reduction strategy in the province of Ontario, and taking a look. As you know, there's an annual report that's written, and there are some performance metrics that are looked at and so forth. And so we are really examining how to do that in a fair and transparent way. So maybe this next part is less relevant to you in terms of on-the-ground things, but in government we think a lot about what we're already doing and how things need to connect, because we can't keep starting from scratch. We have to build on the things that we're doing and build on the momentum. And there are two important strategies to us that we're going to be paying close attention to. So one is the special needs strategy, and the other one is the Aboriginal Child and Youth strategy. And these are important commitments government has already made. So in our minds, FASD fits under that, but it's just the way we work. So I just want to tell you about those strategies, so when you hear about them, you'll understand the connection. So the goal of the special needs strategy is to connect children and youth with special needs to the services they need as early as possible and improve the service experience for kids and families in 3 areas. So one is about identifying children and youth earlier and getting them the right help sooner. So that's about training the providers. It's about new developmental screens for children in preschool and helping assess children's development that would help assess that as early as possible. So I hope that theme resonates with you from what I said earlier about getting the help sooner in the community. And coordinating and service planning. So there is investments that will come around new service planning coordinators for children with multiple or complex special needs, and that does include, as we know, FASD, to connect the families with the right services and supports. And then making the supports and service delivery seamless, integrating the delivery of rehab services to ensure the services are easier to access and seamless from birth to school years. And there's a lot of reason to pay attention to those early years, because we know that if kids are engaged in school, if they have the supports that they need, they can stay in school, they can graduate. And those are important markers for success. And as Mr. Anderson talked about, prevent those secondary disabilities as they go up. We really want there to be a day where it's not an adult with FASD that is diagnosed, that is known well before and managed well before. And I'm seeing nods in the room. So I'm just telling you what you know, but I'm telling it so that you know we know and we understand those pieces. So that's a part there. And the other one is the Aboriginal Child and Youth strategy, which is a big thing for us because it is a promise. It is a promise and a commitment to Indigenous communities that we are going to do things differently in terms of our partnership with them and their communities. So really the goals of this, again, simple, hard to get there, but really important, clear goal. It's to enable community-driven, integrated, and culturally appropriate supports for Aboriginal children, youth, and families so that services better meet their needs. So we focus together with them, and there are technical tables that we have with folks where we are looking at evidence-based transformations, and we are co-developing and co-designing and co-delivering what we do for children and youth in the province of Ontario. And so everything that we do in our ministry and by association in the province, we do in this new way. It is a commitment, and it's really, really significantly important to us. Looking ahead. So, a whole of government approach to FASD. Very important that we look at the provincial frameworks and programs and services that really do look at the complex needs of children, youth, adults, and families with FASD. What do we need that's net new? What do we need that is existing that need to be reprofiled or recreated or extended to make the impact that we need to have that reach? As I said to you, we're working with our partner ministries on this. We've been a little quiet since all of the stuff in the roundtable, but it doesn't mean it's going away. It means that we're behind the scenes doing that work to make sure that we get it right. I talked to you already about the FASD aligning with other strategies, and I wanted to also reference with you, you might be interested in this, that the Ministry of Health and Long-Term Care is currently leading consultations on the alcohol policy framework. If you're interested in this, there's a piece on their website to take a look at. And so when we think about responsible drinking, when we think about guidelines and so forth of that, there's a natural connection and a synergy there, which is something that we are fostering with the Ministry of Health and Long-Term Care. So I also want to make a commitment to you that we are continuing to listen to you. Folks are, continue to meet with folks. If there are interesting people that we hear about, we are so ready and willing and really wanting to get on the phone and talk with them. And we plan to come back out with a strategy to you and work with you to implement it. I'm not announcing it today, despite what you read in the paper. But in fact, it is going to be coming. And we're going to do it in a thoughtful, multi-year way. No silver bullet, but we are going to take a look systematically at how we move forward on this. Please check our website, and when we're ready for an announcement, we will certainly let you know. Thank you.
Are you open for questions? Sure.
Yeah.
We have time for questions.
Okay.
Yes. We have about 10 minutes for questions.
So does anyone want to say anything to me, or any questions or discussion? I don't, seriously, humbly, I didn't want to say Q's and A's as if you ask and I answer, because it's not like that, truly. Sometimes I should be asking and you should be answering. So that's why we just had a few minutes. I know I wasn't going to be speaking for half an hour. Does anyone have anything they'd like to say?
As a member of the FASD-ONE task force diagnostic team, I don't see any, you talked about the need for access to diagnosis, and I don't see that in that heading forward. Can you answer that, please?
It is there. It's intended, oops. Can we? It's in a pillar of
There it is. Going back.
screening, assessment, and diagnosis. Yeah.
But in the going forward science, there was nothing about diagnosis there, or funding of diagnosis. Increased psychology availability. The stumbling block is not having psychologists funded for the teams. And there's not a, in the next couple of slides, where you're saying going forward, there is no comment about increasing that availability.
It's not a gap in our understanding, and we do understand the issue. So we, that is one of the things that we're working on with the Ministry of Health and Long-Term Care, to really take a look at psychologists' availability and things like that. So I will just say to you today that we are aware of that issue.
Hi.
Hi.
Is it on? Yep.
It's on.
Hi, my name is Sharon Richards, and I'm the chair of the local Toronto FASD Coordinating Network and the former chair, actually, of this wonderful group. But I just want to acknowledge everyone, when we were here 2 years ago, we were all talking about the need for a provincial strategy. And so we've made a lot of progress in 2 years, because you're here today talking about the fact that in fact is being developed at the provincial level. And while we all may have things when it comes out that we might want to see added that aren't in there, I just think I want to say a lot of congratulations to this current government for finally having a provincial government that understands the importance of addressing FASD and getting on with some kind of a provincial strategy.
Thank you very much for saying that.
Yes, it's on. No, it's not. Oh, okay.
Just start talking.
Hi, and I echo what Sharon has to say. My name is Mary Cunningham. I'm one of the co-leads of the Education Action Group. Where do you see the education system fitting into all of this? Because if we get them before they go to school and we have good supports, which we don't have now, we will not have the adults with the complex needs. We don't see it. We're just a few comments on that.
Yeah, it's really, really important. So you've said a few important things. We need to take a look at before they go to school, and then we need to take a look at when they go to school. And so our colleagues in education are really walking closely with us on this. And so teachers need to understand that what they tell Johnny to go sit down, take out his book, go to page 3 and answer questions 4 and 5, that if Johnny just goes and sits down and forgets the rest of the instruction, that he's not trying to be a pain, right? If he's got it. So there's a bunch of things around teacher training and classroom management techniques. There's a bunch of stuff about awareness of the people, the adults, not just the educators, but all the adults in schools who notice children, who can notice early, and if things have not been diagnosed by that point, to be able to know what to look for and to be able to know who to go to get the supports they need for that person. So we had raging debates in the conversations that we've had with some experts about whether you need or don't need a diagnosis. If you have a diagnosis, fabulous, but if you don't have a diagnosis, it should be possible, somebody said to me, I won't name her, but I have a lot of respect for her, it should be possible to go through school and get what a child needs based on what they're presenting in terms of educational supports. And so what I would say to you is that our education colleagues are totally committed to this. So like everything else, how can you make that really reach into everything that's going on? And that's going to take a long time.
Good morning. My name is Alan Mountford. I'm also with the Education Action Group, and I appreciate all your efforts, and what has happened in this province is indeed fantastic. I also have concerns regarding how what you say is going to actually roll out. Mm-hmm. In terms of education, we have not felt, I know I am speaking for some other people here, and I apologize for that, but there are many of us who have not felt that, despite it being said that this is really important, we've not felt that the Ministry of Education specifically has listened to that. And when we take a look at the report, we see nothing that says education, nothing. I get that you can put us under programs and services, but we are being told that we are one of many special interest groups that are in line mm-hmm. for services, and we're just going to have to wait. And that's not acceptable, as far as I'm concerned.
I'm representing the FSD Prevention Action Group, and you don't know how excited I am to see alcohol policy framework up there. I'm really excited about that. I wasn't sure that was getting through, so I hope we can really look at the policy piece with respect to FASD and the need to limit availability and marketing and all the things that go around alcohol policy that I think there's some tension in this government about. So I'm really happy to see that. But I also am excited to see with the Ministry of Children and Youth Services that that's where the strategy lies. But as far as prevention is concerned,
if you're not working explicitly in that area, how are we working with some of the other ministries? And I beg you not to just do a awareness campaign, that we really look at the Public Health Agency of Canada's 4 levels of prevention. And that's why I'm so excited about alcohol policy being in the center of that, because it's integral. So I just wonder if you could answer how, if it's with MCYS, how are we going to get the action around screening and for all women in their childbearing years around alcohol and birth control, the strategies, the services for women that are struggling with substance use, and then after they have their children, how can we work with them again because they're preconception?
Yeah. So we don't have it tied up in a big bow today, but the way to do it is through that interministerial piece and holding ministries, not only ours, but others accountable for results. And there's internal mechanisms to do that because we all report to cabinet. Right? So the things that you're talking about, in my mind, is the complex work that we are responsible for undertaking to really say to other ministries and work with other ministries so that they pay attention, so that they reach deep, whether it's education or whomever it is, to say what are the things you're doing now and what are the smart extensions to that you should be undertaking. So my best sense of it at this point is that we're going to start somewhere. And whatever we start with, and thank you for the comment over here, whatever we start with won't be the whole thing. Whatever we start with is a place to start, and then we keep going, right? But we do that in a transparent and informed way. So I take your comments back. They're good thoughts. Thanks.
I just have a.
Can you?
I just have.
My name is Brenda Stade, and I work at St. Michael's Hospital Diagnostic Clinic. I just wanted to echo what Peggy Kirkpatrick said about the psychologist. Like, that's one of the crucial things. And I am actually retiring from St. Mike's in June, and focusing on my daughters. And there's such a backlog of referrals from all over Ontario. So it's a huge part of it. But I want to say I'm really excited about what you're doing. And I think we've come a long way over the last couple of decades. But down to the child level, because I have a young 13-year-old with FASD, and who I adopted, and I'd never been a mother before. And I was a terrible mother, I think. I think I'm a terrible mother. But she says I'm a really good mother. But I knew nothing, even with all my experience in FASD, I didn't know how to help her because she was a child from the system. She'd been in 5 homes before. So I tapped on every little door I could, and having Mary Cunningham and knowing Brian Philcox and all those people, and and we put down the Children's Aid a lot, but Catholic Children's Aid, they funded me for some horseback riding lessons, which she still continues with, and it's made a major difference in her self-esteem. Yeah. And she's now got a friend, right? I took her out of the school system, as the educator said. She couldn't function. A vice principal said to me, "Does FASD have anything to do with behavior?" So we took Sarah out because she was very suicidal at that point. I homeschooled her, and now she is at the age of 13. She just turned 13. She's doing high school via the Ontario. I'm not a teacher. It's the learning centers, but it's the Ontario diploma, and she's doing really well. I actually despite she didn't want me to do this, but I talked to the teacher. He said, just make sure she answers every question. That was the problem in her organization, because she's getting like 10 out of 12 on her questions. Wow. She answers, but leaving out 5 questions, and I don't know how she's passing. But so she's doing well. But it's really, it's a hard struggle, and I'm sure Peggy and everybody who's been involved, these kids are just not one thing. There's so many things. Yeah. And so for like diagnosis, like we have kids with they have autism also. Yes. And they have so many things. So what label can you give them to help them? And then for us, we have people coming in, and I feel like we're doing like a supermarket diagnosis, right? But you don't have the aftercare because they're so far away, and everybody wants the reports. But I'm excited. And when I retire, and I'll still be doing other things, but you're provincial, but I want to go and see if Justin will let me, Mr. Trudeau will let me. I'll take Maureen with me and then we'll go up there. Thank you.
Well, far be it for us to try to compete with Justin. Thank you for your comments, and you sound like a wonderful mother.
Thank you for that, Brenda. My name is Brian Philcox from FASD-ONE, and I came a bit late today because of a fire on the subway system, so everything was jammed up. But I may have missed this, but I'm wondering, we're working across ministries, or we say we are, and Kathleen has said that she wants everybody to be involved, but I don't see anything about the real monster in the room, which is the largest purveyor of beverage alcohol in the world, which is the LCBO. And if we forget about LCBO in the mix, we're forgetting about a major, major part of what could be an important partner in this whole progress.
Thank you.
Hi, good morning. My name is William Tarbett, and I'm a classroom teacher in an FASD class, and I just want to, I'm relatively new sort of to the FASD community, but just wanted to find out if you can comment on just funding around supporting school boards and the Ministry of Education with regards to classrooms, and with not enough funding, because it does come down to dollars and potential of classrooms closing or programs because there's not enough funding.
Thank you for the question. And I'm really pleased to see that a teacher is here today. That's really fabulous. So funding is a big issue. So put yourselves in our shoes as bureaucrats in the Ontario government. So line up all the people who want to, seriously, on very important causes, want to get new funding. So we will always seek new investments. We always will. That's our job, is to build a case to government for why we should get investments. That's why we need the performance indicators and the outcomes pieces. So we're going to do that. But that's why. But given that the answer isn't always yes for everything, and I mean, I have a lot of other files, and colleagues across ministries do, and in government, you understand that, you have budgets. The other thing is how to reprofile and how to make sure that we're paying attention to the right things. So I'm absolutely convinced that not everything we do is worth the money right now. I'm not talking about you, I'm just even in my branch, right? Absolutely convinced. So doing that smart and hard work to embed the things that we focus on and the things that we fund and the way that we do it in a way that has the maximum impact is the most work. I actually believe, and I've been in government actually over 30. I stopped counting at 30. I was interested to hear it was 26 today, so I'll take that. But I do think we do our best work in government actually when we don't have a lot of new money, because we have to be more thoughtful about systemic change. And I'm not suggesting for a moment I'm not into getting new money, but it's about systemic change. It's about the way we're working in communities. It's about drawing those lines for everyday people and families so that they get what they need in the communities. I haven't answered your education question because, as you well know, the Ministry of Education gives money to school boards, and school boards make local decisions. So the reality of one board and another board, one area of the province and another area of the province, as you know, will look very different in terms of what they fund and how they fund it. Section 23 classrooms, I mean, all of that stuff. What we want to do is to make sure that there is profile provincially on FASD so that the Ministry of Education is talking to school boards about what about FASD and having some dedicated conversation about what that looks like in boards in communities. So I would say that. And I think I'm out of time. So thank you very much, and I really look forward to continuing to work with you.